Al-Ansar. Doctors and guests on the Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al-Ansar will be held responsible for any ill health caused by the advice given on Radio Al-Ansar.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وسيدنا محمد وعلى آله وصحبه أجمعين. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to the Medical File program brought to you by the Islamic Medical Association of South Africa. I am Dr. Farouk Haffejee, your host for this morning's show. Alhamdulillah. Medical File is usually broadcast on a Tuesday night between 8 and 9 out of Ramadan. But during Ramadan, we are having this program between 9 and 10 on a Saturday. We got one more Saturday to go, and that will be the end of Ramadan. See how fast Ramadan is going. Amazing. It's already 17 days gone and moving very fast. So we should take advantage of every opportunity we have to make as much ibadah as possible. Read the Quran. Yes, that's the important part of Ramadan. Whatever time we have, we should devote that to the Quran. So today we are talking about diabetes. It's already more than halfway gone, Ramadan. But we're going to be talking about diabetes with the aim of trying to help people who have diabetes and who are fasting or want to fast, but also as a general information for diabetes, for people with diabetes, and also for people who may be prone to diabetes. And so, you know, it's worth listening to this. And in fact, you know what, diabetes is so common that a lot of families, most families actually have one diabetic or two diabetics or some diabetics in their family, or they know of somebody who has diabetes. It is so common. So to make us understand this, we have endocrinologist Dr. SAAJIDAH BULBULIA. She is from Gauteng, and we are very happy to have her on this program. In fact, it's a very short notice. She came in, rearranged her schedule, and she is here now with us to talk to us about diabetes. She is an endocrinologist. Assalamu alaikum wa rahmatullahi wa barakatuh, SAAJIDAH.
Wa alaikum assalam wa rahmatullahi wa barakatuh. How are you, Dr. Haffejee?
Oh, alhamdulillah, alhamdulillah. We're having a milder day today. You know, we have been having temperatures in the 30s here in Durban. I don't know how it is there. And fasting with temperatures above 30 is, and humidity. We have humidity. You don't have humidity there, which is quite challenging for us.
It's been quite hot here as well. It's been raining for the last 2 days, so that's at least a little bit better.
Yeah. Jazakallah khair for joining us, and we really appreciate your knowledge and your information that you're going to be giving us. So we're talking about diabetes, and you are a specialist in diabetes, and we've got the right person here with us. Diabetes has become so common these days. Every second person you talk to has somebody that they know who's got diabetes. What is the incidence of diabetes worldwide?
So worldwide, about 14% of adults, which equates to about 537 million people, live with diabetes as of 2022. In South Africa, that's a number between 2.3 and 4.5 million adults. This makes it a major global health crisis, and this number is expected to rise to about 1 billion people by the year 2050. The biggest problem with this is that a large amount of people, about 50%, remain undiagnosed and present with complications at the time of diagnosis.
Oh yes, that's the target audience that we're looking at. Those who are undiagnosed, those who have diabetes or another condition called impaired glucose tolerance. We're going to talk about that later. And please listen to this, because this happens in people who don't think they have diabetes, and in fact is something that's very worrying. So listen to us, and we will get there as time goes on. So now, just talking about diabetes. how would a person know that they may have diabetes? What are the symptoms, Sajida?
So the most common symptoms of diabetes is excessive thirst and frequent urination. And this is because the kidneys work harder to filter blood glucose into the urine to get rid of the excess glucose. In addition, people may feel fatigued, experience unexplained weight loss, have blurred vision because of fluid shifts in the eye or damage to the blood vessels, have slow healing sores or wounds, and infrequent infections on the skin, gums, frequent flus, or cuts that take a long time to heal. They may have skin changes such as darkened skin in the neck and armpits, and then they may experience already symptoms of target organ damage like nerve damage in the hands and feet with numbness, tingling, burning in the feet, especially at night.
Yes, and so if you have any of those symptoms, please go and have your blood sugar tested. We should all learn how to do this blood sugar test. We have relatives in our family. We have people who we know who have a glucometer. That's a machine that tests our blood sugar levels. I think everyone should learn how to do this test. You never know when you may be helpful to somebody who may be in trouble and you need to do a blood sugar test on them. So learn how to do it. And in fact, you should do it on yourself. And it's so important for us to have our blood sugar done, even if we don't have diabetes. And doctors recommend that, we recommend that you have a blood sugar test at least once a year. Twice a year is even better. And the reason for that is another condition called impaired glucose tolerance. Now, this is a stepping stone to diabetes, and if we catch it at this stage, you can save yourself a lot of problems. Sajida, what is impaired glucose tolerance?
Impaired glucose tolerance is a condition, a pre-diabetic condition, where the body doesn't metabolize glucose adequately, but the numbers don't equate to what we use to diagnose diabetes. The important part about this is that at least between 20 and 50% of people who have impaired glucose tolerance will develop type 2 diabetes over the next 10 years. The risk factors for impaired glucose tolerance include things like obesity, physical inactivity. The rates increase with age. If you have a family history of type 2 diabetes and other conditions like hypertension, polycystic ovarian syndrome, and previous gestational diabetes do increase your risk of impaired glucose tolerance. Symptoms can include those of type 2 diabetes, as we mentioned, with lethargy, fainting, cold sweats. And this can be treated with lifestyle changes and dietary adjustments. But in some cases, the same medications we use to treat diabetes may be prescribed to get the condition under control a lot faster.
So this is not diabetes. It is a precursor to diabetes. So with the result that if you catch it early, you can actually delay getting diabetes, Sajida?
Yes, you can. So if you catch it early and we make the appropriate lifestyle and dietary adjustments in terms of food, exercise, inadequate sleep, adjusting work stress or family stress, then we can reduce the risk of developing type 2 diabetes or prevent type 2 diabetes from occurring.
So you see, it's how important it is for us normal people, what we regard as non-diabetics, to have that blood test done, once every 6 months or so. Just do it and see where you are. And we'll give you some figures later about what you should be aiming for. Although we are talking about managing diabetes during Ramadan, and this is helpful for people with diabetes throughout the year, anytime. And the same principles will apply, actually. And we will talk about family members as well, about how they can help people with diabetes, because it's important. They're living in the person with diabetes is living in a home environment, and so we need to make it easier for that person with diabetes to control the condition. And one of the starting points with controlling diabetes is a diet. So I think the family members can help there tremendously. Saajida, what do you think?
I think family members play a big role in how people adjust to the diagnosis of diabetes and manage their diabetes. Families can offer good support in terms of assisting with daily tasks like healthy meal preparation and meal planning. In fact, the whole family can join in by switching to a healthier diet plan that will be beneficial for all of them. They can also encourage the diabetic person to perform regular exercise and better yet join the person in exercising. And we usually recommend at least 150 minutes of exercise, such as walking, running, cycling, or swimming for the week. And they can also assist with things like glucose monitoring and reminders to take or collect medication. They can learn to recognize signs of diabetic emergencies such as hypoglycemia and hyperglycemia, and learn how to assist the person when they cannot assist themselves. And then most importantly, they can provide emotional support in terms of helping to understand and accept their condition, attending their doctor's visits with them, respecting their decisions regarding their care, even when you disagree with what they want. And these all can help reduce stress and in that way reduce complications from the diabetes.
Yes, and and diabetes, of course, runs in families. So if you have a person with diabetes in your family, a mother or father or grandfather, grandmother, it's important for you to have your blood sugar tested because, inshallah, you won't get diabetes. But if you do, and if you catch it early, that will be a tremendous advantage to you. And you know what? Now with diabetes, I mean, from 30 years ago or 40 years ago, it was a blanket rule that if you had diabetes, you shouldn't fast. And the problem was that we were worried about hypoglycemia. But now with a lot of research being done all over the world, actually, we now know far more better about diabetes and fasting. And in fact, we noticed that although there was a blanket rule at that time that people with diabetes shouldn't fast, there were many diabetics who were fasting, and in fact, their health improved. And that has been now proven with the research that's going on at the moment. We have learned a lot in the last few decades. So, what are the dangers that people with diabetes face during Ramadan?
Okay, so the things that people face in terms of severe health risks during Ramadan include things like high blood sugar or extremely low blood sugar, dehydration, and blood clots. And this is all because the changes in meal timing, food intake, and sleep patterns. This can be minimized by seeking your assistance from your healthcare provider in terms of adjusting your meal timing and medication, as well as how to prevent these issues, which we will talk about a little bit later as well.
Yes, so there are dangers with fasting, with people with diabetes and fasting. There are dangers associated with it. And so let's first start by asking what types of people with diabetes who should not fast? And I think that's an important question.
So that is very important. Those that should not fast usually include anyone with very poorly controlled diabetes. So someone who has frequent excessive lows or excessive high sugars. Someone who's had an extremely low or high sugar requiring admission to hospital in the last month. Someone with severe complications like advanced kidney disease, ischemic heart disease, or eye disease. And then other groups include pregnant women, elderly, frail patients who require lots of assistance with everyday living, someone who's had a recent acute illness, and then those patients taking multiple injections. But again, everything needs to be individualized, and you need to see your healthcare practitioner before you make the decision on whether or not to fast.
Yes. Now, there is a website called DAR Alliance, DAR Alliance. It's actually Diabetes and Ramadan. DAR Alliance. I think people with diabetes should go onto this website, and there is a lot of information there from research research that has been done on people with diabetes fasting during Ramadan. Now, this is to help people with diabetes, and if you are unable to get onto the website, get one of your younger relatives, your children, grandchildren, to try and get you onto that website, DAR Alliance, and you'll get a lot of information there, and you'll be able to. And there's a dietary plan there as well, and there's a risk calculator as well, which we will talk about a bit later. And that's important, that risk calculator, because something new that has come up. It makes your choice of whether to fast or not easier. And you know exactly what your risk is. So we'll talk about that risk calculator a little later. Now, when you're talking about fasting, a person with diabetes fasting during Ramadan, when should they test their blood sugar levels to make sure that their blood sugar levels are fine? I think maybe before that we can just give a general guide as to what the blood sugar levels should be fasting and 2 hours after a meal. Sajida?
Okay, so in general, fasting blood glucose should be between 4 to 7, and then 2 hours after meal should be around 10. Again, this can be individualized depending on your risk factors and your general glucose control and your target HbA1c. So your doctor will usually tell you what your targets are, but those are the generalized targets that we have.
So during Ramadan now, a person with diabetes, when should they test their blood sugar levels to make sure that the medications that they are using is controlling the blood sugar quite okay, and there is no danger of either going hypoglycemic or low blood sugar, or hyperglycemic or high blood sugar? When are the times when they should be testing this their blood sugar levels?
Okay, so we usually will test around suhoor, so before and maybe 2 hours after suhoor, at midday, because this is the highest, or later in the afternoon, because this is the most critical time where we see hypoglycemia symptoms and hypoglycemia occurring. And then just before iftar and 2 hours after iftar, and then sometimes before bedtime, if that is much later. And then anytime the person feels ill or has symptoms of hypoglycemia or severe hyperglycemia, that person should test and then treat accordingly.
Yes, you see, because we haven't eaten the whole day, that blood test around Asar time is a very important blood test, because that will tell you how low your blood sugar is going to go through the day. And if it's gone very low, what happens, Sajida, if your blood sugar is below 4 that you mentioned, on the lower level, between 4 and 7? What if the blood sugar is around 4 or just below 4? What should they do?
Okay, so generally, if your blood sugar is under 4, so under 3.9, then the recommendation is to break your fast and eat something to correct the blood sugar. Symptoms of low blood sugar include dizziness, sweating, confusion, difficulty remembering things. So this is quite critical. It is critical to break your fast here, because this can lead to a hypoglycemic coma and nerve damage as well, or brain damage as well, if we don't address this.
Now, earlier we spoke about the diet, and in Ramadan, there are a lot of sweet things that are prepared, and some people actually discover that they are diabetics during Ramadan because of all the sweet things that are presented. So for families, it's important to make sure that you don't present on the table things that are very sweet when you have a person with diabetes in your family, and because diet plays a very, very important role in the control of diabetes. Sajida?
Yeah, so diet does play an extremely important role. It's important that we still eat whole, nutritious meals or balanced meals during Ramadan, especially for the diabetic person. To note that they should have some protein at suhoor, with a small amount of carbohydrates and fats as well. And then they should reduce, as well as at iftar, protein is important. Adequate water or hydration is important for the diabetic patient or all people, especially during the summer months. and then to reduce the sugar and fried foods, desserts, savories as much as possible.
If you're baking at home, and maybe an idea to cut the sugar in the recipe by about half, so it won't be as sweet for the person with diabetes, and in fact, it'll help the whole family. And I think that may be something that you can think about as you prepare the food. SAAJIDAH, there are a whole lot of new medications that have come about as far as diabetes is concerned in the last decade or 2 decades. And we're going to go through some of the medications and see how we can help people try and adjust their medications. This has to be done with your doctor, because your doctor knows your condition very well. He knows what other comorbidities you have, other conditions that you have, which may impact on your diabetes, which will impact on your medication that you take. So it's important for you to do these changes with your doctor in the loop. We're going to go for a break now. And if you want to communicate with us, you can communicate with us on WhatsApp on 060-904-1056, 060-904-1056. And we'll be glad to take your questions and provide you with an answer if possible. But remember, the answer we give you is on condition that we don't know your full history. So we can just generalize, and you need to confirm that with your own medical practitioner. So I'm talking to SAAJIDAH BULBULIA. She's an endocrinologist, and we'll be back again after the break.
The very informative medical files with Dr. Farouk Haffejee on Radio Ansaar.
Radio Ansaar, 24/7, 365.
Ramadan is here, a month of mercy, sharing, and giving. And once again, the Breakfast Rush team and the School Matters team is preparing to serve thousands of meals throughout Ramadan. And on the blessed day of Eid, our target is 1,000 eggs at 1,850 Rand, strictly lillah. Your contribution can reach hearts and homes this Ramadan. Call Outreach now on 031-208-1601.
Welcome to Simplex Radio. Visit our showroom for the full range of car audio. Our TV department carries top brands with quality LED panels, full HD to Ultra HD, and now the experience of Super Ultra HD. Visit our theater rooms and transform your home with brands like Onkyo, Integra, Denon, Boston Acoustics, Yamaha, and more for quality audio-visual experience. Now available, full range of home appliances. A one-stop shopping experience. Call 031-306-4029 or Kenilworth Park, 202 Brickfield Road, Overport. Simplex Radio, the name you can trust.
This blessed month, keep your body strong and your ibadah focused. Boost immunity with Tib Black Seed, the Sunnah remedy. 60 capsules for just 129 Rand 90. Need energy and focus? Grab Turbovite XL, 20 sachets for just 129.90. And for a nutritious meal supplement, try Replace Classic, 400 grams for just 145.90. Available at all Sparkport pharmacies. Our Overport store open until 10 p.m. daily. Order on Uber or shop online. Sparkport Pharmacy, your health, our priority.
If your evening is like this.
Traffic is bad. Show mama, I wash your windscreen very much.
Take your moment to enjoy that blissful alone time while you relax in a Satiskin bubble bath. Also available in shower gel and hand wash, the Satiskin range is pH balanced for satin soft skin. Satiskin, take your moment.
The very informative medical files with Dr. Farouk Haffejee on Radio Ansaar.
Doctors and guests on the Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Ansaar will be held responsible for any ill health caused by the advice given on Radio Ansaar.
Assalamu alaikum wa rahmatullahi wa barakatuh. Most people pay their zakat during the month of Ramadan. Reminder to keep the Islamic Medical Association of South Africa in mind. They need zakat to run various programs like the renal program, providing dialysis to zakat recipients, to people who cannot afford the ongoing dialysis for the IMA South Africa cataract program, giving sight back to people who cannot afford the operation, and to care for the elderly in the facility that cares for the elderly, and a whole lot of other areas where health support is needed by zakat recipients. You can phone the IMA office in Durban 031-209-7838, and they will help you with details on how you can give your zakat to the Islamic Medical Association, 031-209-7838. If you just joined us, we're talking about diabetes, and with particular reference to Ramadan, but generally as well with people with diabetes, you will benefit from this program. Also, we're talking about specifically for Ramadan. We have our guest endocrinologist, Dr. SAAJIDAH Bulbulia, and we are grateful for her presence. We were talking about medication earlier, and let's see how we can help you with your medication. It's and see whether what the reasons are why we are doing what we do with changing your medication as Ramadan goes. Now, we'll try and take each category of medication, and you can work out what you should be doing, bearing in mind that the best way is to get advice from your doctor who knows your medical history. This program cannot inform you about what changes you need to make, as we do not know your full medical history. So this is just general advice, but confirm it with your doctor. Now, the basic medication that is used with diabetes, the first line medication is a medication called metformin or glucophage, and every diabetic will be familiar with this medication. Are there any adjustments that need to be made, SAAJIDAH, with the metformin and glucophage?
Okay, so with metformin, if you're taking metformin only once a day or you're using prolonged release metformin, we advise you to take it with iftar rather than at suhoor time. And then if you're taking twice daily dosing, that remains the same to be taken at suhoor and iftar time.
Okay, so metformin, what are the chances of getting hypoglycemia with metformin? Okay,
the chances of getting hypoglycemia are very low, but they do exist, and they increase with the if you are taking other medications or insulin, and that's why we recommend, if you're taking once a day metformin, to take it with iftar so that you can eat if your sugar becomes low.
Okay, and another class of drugs is what we call sulfonylureas. They're short-acting and long-acting ones, and these are like glycomin and dimicron, MR, long-acting ones. What adjustments do they need to make as far as this is concerned?
So again, with the sulfonylureas, we usually recommend at iftar time. If it's a once daily dose, if it's a twice daily dose, we recommend keeping the iftar dose the same, but the suhoor dose maybe need to be reduced or even stopped. And the choice of sulfonylurea is usually glycoside MR. So if we're taking something else and we can change it, we should see our doctor and recommend it asked to be changed before Ramadan.
Yes, one of the problems with sulfonylureas is that it drops the blood sugar down quite drastically, and that's what we worry about during Ramadan. So just be careful there. Check with your doctor and work out what needs to be done. There's a question here about constipation during Ramadan. This person is a diabetic, and there's a problem with constipation. Constipation is very common in Ramadan. Is because we are not eating our normal meals and we are not drinking water during the day. And those are the two requirements that we need to keep our stools soft. And so you can still do that by having a high fiber diet. Make sure that you have a high fiber diet. In the morning is a good time to do that at suhoor. And dates are very good. And if you're diabetic, remember you can't have too many dates. You can have maximum of 3 dates, and try and choose the dates that are not so sweet. The sweeter the dates, the higher the glycemic index. The less sweet it is, like ajwa dates are very good because they're not very sweet, and then they're medium glycemic index. So, and also chia seeds are very good. You can have chia seeds in water, and you can have stool softeners that you can buy over the counter at the chemist, and these are things that you can use to try and stop you and make sure that you are well hydrated when you start the day. Full tank. You must have full tank of water during the day, in the morning when you start the fasting. If you start with 70%, 80% of your requirements, your fluid requirements, you're already starting the day partially dehydrated. So make sure that you are drinking enough water through the day. You want to add anything, SAAJIDAH, to that?
No, I think you've covered most things, Dr. Haffejee.
Yeah, okay. Now, there are newer drugs that are on the market, and people may be wondering how to take it, and some people may be taking it. There is a class of drugs called the DPP4 antagonists. It's like Galvus, Gelra. I'm just giving you some names because people may not know what DPP4 antagonists are. Now, if people with diabetes who are on these drugs, do they need to make any changes?
Okay, so these drugs are really good for diabetic patients, and also the to be taken during Ramadan. They are what we call Ramadan-friendly drugs because they maintain good glucose control without very much weight gain, and they have a very, very low risk of hypoglycemia. These usually do not require any dose adjustments during Ramadan, and can be taken at iftar if you're taking it once a day, and at both suhoor and iftar if it's been taken twice a day without any adjustments being made.
Jazakallah. It's a good drug to take, and not only during Ramadan but during normal times as well. It's a very very good drug to get onto. And also there is another question. I'm a diabetic, and in Ramadan I feel lightheaded during fasting. It goes away and then comes, and then after iftar, a little headache. You need to have, you are showing symptoms of low sugar. So, SAAJIDAH, this person is getting lightheaded during the day while fasting. The person is diabetic, and there's also a bit of headache and uneasiness and at night after iftar. What do you recommend there?
Okay, so importantly, to check your sugar at times when you're feeling unwell during the day and at night, to make sure this is, or to assess whether this is due to the glucose or something else. If your sugar, like we said, is below 3.9, then this would necessitate breaking your fast during the day. It's important to actually hydrate properly overnight, and like we said, have proteins and low GI carbohydrates that will keep you fuller for longer and keep your glucose under control and stable a lot longer during the day. And then it may be important to actually see your doctor to adjust whatever medication you're taking, because you may need to cut out or decrease your medication at suhoor time, and maybe even decrease your medication at iftar time. Importantly, that most diabetics actually have other comorbidities like hypertension, and these medications may also require adjustment to prevent low blood sugar and dehydration during Ramadan. So it's important to see your doctor if you're experiencing any of these symptoms.
Yeah, there's a question here on a person who has diabetes, and they've been on metformin, 500 milligrams twice a day, but they were hospitalized for a knee problem, and in the hospital they checked the blood sugar levels and added Gelra to it, 50 milligrams twice a day. But I'm coping well, and I'm fasting. Sugar reading is between 6 and 7, very well controlled. No sweet drinks, and savories, complete abstinence from all these. Have a diet sheet following it. diligently, made the changes. Alhamdulillah, shukr. Everything is, these medications have made quite a big difference. So here's a person who's really taken this diabetes and control of diabetes very seriously. SAAJIDAH?
Yeah, I think that's an excellent use of the diet and medication. Like we said, those medications don't need to be changed. And if you're following a good diet, eating well, and your sugar is between 6 and 7, we are extremely happy with those patients.
Yes.
And they are safe to fast in that case, from the limited information that we have.
Yes, and in fact, he says that they've stopped the metformin. It's only on Jalra now. So that's a DPP4 antagonist. So anyway, that's a new line of drugs, and people with diabetes should actually plan their next Ramadan from now to work out what medications they need to be. In fact, it's a good idea to get on to these good Ramadan-friendly drugs all the time. So when Ramadan comes, you're already on these medications. And so it makes it easier for you to fast during Ramadan with these Ramadan-friendly drugs. We're going for a break. When we come back, we'll talk about another class of drugs which is taking the world as far as obesity is concerned. The GLP-1 agonists like Ozempic, and that class of drugs. We're going to be talking about that after the break. And I'm talking to Dr. SAAJIDAH BULBULIA. She's an endocrinologist. And we're talking about diabetes and diabetes control. So we'll see you after the break.
The very informative medical files with Dr. Farouk Haffejee on Radio Ansaar.
Radio Ansaar, 24/7, 365.
Indulge in the luxury of vodka, Dubai's finest chocolates, with unique Middle Eastern flavors like pistachio kanafa, lotus kanafa, hazelnut kanafa, and angel hair. Every bite is a taste of opulence. Vodka chocolates. Treat yourself or gift someone special this Eid. Available at leading retail stores. Vodka, the taste of luxury.
Are you looking for Islamic accessories that embody tradition and elegance? Look no further than Taiba Exclusive Islamic Accessories, your premier destination for high-quality, stylish, authentic accessories for men. Discover everything from finely crafted kufis and shawls to turbans, signature fragrances, rich buhur, Ramadan essentials, Eid gifting, and more. Complete the experience. Infuse your garments with luxury using our exclusive buhur clothing hanger. Taiba has everything you need to elevate your style with timeless tradition. Visit us at Shop 7, Gem Towers, 98 Overport Drive, Sandwood, and discover a curated selection of premium products from around the world designed to enhance your everyday lifestyle. Or shop online at taiba.co.za. WhatsApp us at 083-607-2488. Taiba, exclusive Islamic accessories.
As we observe the blessed month of Ramadan, financial uncertainty can be a distraction during a time meant for focus and reflection. Anglo Wealth Sharia offers a transparent, Sharia-compliant, asset-based investment solution, giving you clear insight into how your wealth is structured with returns of up to 17% per annum. Prepare your wealth as you prepare your heart this Ramadan. For more information, call 031-566-5201. Anglo Wealth Sharia is a registered national credit provider.
This Ramadan, the afternoon jam team is on a mission. We are bringing bottled water and dates to masajids and communities at Iftar and Tarawih. And we need you. Strictly Lillah only. Call the Outreach Department now on 031 208 1601. Come join the blessings. Let's make it happen.
Radio Ansaar, 24/7, 365.
The very informative medical files with Dr. Farouk Haffejee on Radio Ansaar.
Doctors and guests on the Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Ansaar will be held responsible for any ill health caused by the advice given on Radio Ansaar.
Just a reminder again to make some zakat payment to the Islamic Medical Association of South Africa for their programs which are used for zakat recipients. You can phone 031-209-7838. 031-209-7838. There's a question here which is very important, and in fact, it makes us doctors feel very good about this. And it's when glucose levels are 7 to 8 before meals, can one manage diabetes with lifestyle changes, with exercise and diet, without medications? SAAJIDAH?
So it depends on where you're being diagnosed at. If you are newly diagnosed with a just above normal HbA1c or fasting or a 2-hour glucose on your glucose tolerance test, then we can manage this with adequate diet and exercise if you are keen to try that. But most of the time, by the time we see patients, their diabetes is advanced and they have complications that require medication.
Yes, it's important to make the difference out, because if you haven't done, if the diabetes or impaired glucose tolerance hasn't been diagnosed correctly, you may run the risk of getting complications without you realizing that you are actually getting the complications until it's too late. So always make sure that the diagnosis that the diagnosis of diabetes or glucose impaired glucose tolerance is made correctly with the GTT, with the glucose tolerance test. That's the best way to do it. And you need to be clear about this, because if you are borderline and you are managing with the diet and lifestyle changes, alhamdulillah, that's very good. But you need to keep a constant check on your blood sugar level to make sure that you are not going above that level, which then starts causing the complications. Now we're talking about these GLP agonists. They become famous because of weight. It's medication that was designed for people with diabetes to control their blood sugar levels, but of course it caused a tremendous weight loss, and now it is more well known for its weight loss side effect than actually the control of diabetes. And these are, I'll name some because people don't know what GLP agonists are. They are like Ozempic, Mounjaro, Wegovy. These are injections, and you can get tablets as well. So SAAJIDAH, this class of drugs is a very interesting class of drugs, and what can you say about that, SAAJIDAH?
So it is a very interesting class of drugs. It's safe. There's a very low risk of hypoglycemia with no risk of dehydration unless the person is vomiting. It's extremely good for HbA1c reduction and glucose control. It improves satiety, so it makes people eat less as well. There's other effects on blood pressure, cardiac health, lipid lowering, weight as well. It's convenient because it's injectable, and usually if we take the newer ones once a week. In terms of Ramadan, they are considered safe for use in Ramadan, and they're associated with weight loss during fasting, as well as glycemic control with low rates of hypoglycemia. Important to note that we should start these about several weeks before Ramadan and allow for adjustment because of the significant GIT side effects like nausea, vomiting, abdominal pain, which we generally see when starting these. And we should not up titrate our dose during Ramadan because these may worsen side effects as well.
Yes, in fact, you come out with a very important point, SAAJIDAH, and that is that for the next Ramadan, make sure that you get yourself tested about 2 or 3 months before Ramadan starts. It's very important to do that, because if your glucose control is not very good at that time, then adjustments can be made to use Ramadan-friendly drugs to control your sugar levels before Ramadan, and that needs about 2 or 3 months for you to adjust that. So for the next Ramadan, just remember, you go for a checkup about 2 or 3 months before Ramadan starts and talk to your doctor and see what changes you need to make. But this GLP-1 agonists are really expensive medications. They're expensive drugs, and sometimes so expensive that it can turn your appetite away. So But they are very good drugs for use during Ramadan, and those who can afford it can go on to it. Causes tremendous weight loss as well. So people who are overweight will get an extra benefit from it. Besides controlling your diabetes, you can also get your weight down. There's another newer class of drugs which have come on the market, which are called SGLT2. These are Fasiga is one of them. Faxiga is one of them, and these drugs work also to bring the blood sugar down, but they have other good side effects as well, and something that people with diabetes should consider. SAAJIDAH, what do you think about this class of drugs, the SGLT2 drugs?
So on the whole, these again are very excellent drugs to use for diabetic patients, especially those with cardiovascular disease or kidney disease, and they've been shown to be safe in most studies. The important part is that people who are on these medications need to be educated on the risk of dehydration, infections such as urinary tract infections, and diabetic ketoacidosis, so diabetic emergencies. There's slightly higher risk with these medications. In terms of Ramadan, we usually don't require a dose adjustment for this medication. It's usually taken again after iftar time, but importantly, we need to increase fluid intake to prevent dehydration and to avoid excessive salt and caffeine intake, which will cause fluid losses. And then these should be used with caution in patients who are elderly, who are prone to dehydration, or on multiple other medications, unless actually required.
Yes, in fact, it's important to note that it must be taken at iftar time, because if you take this drug at suhoor, we're going to be passing a lot of urine during the day, and of course, the chances of dehydration are very high. So make sure that if you are taking this drug, just switch over from the morning to the evening. Don't take it at suhoor, take it at iftar, and that will work quite nicely for you, inshallah. Because during the night you can drink, you can hydrate yourself, and you have no problems. SAAJIDAH, the insulin changes, the changes with the insulin dosage is quite a complicated thing, and of course this needs to be done with the advice of your doctor. But what general advice can you give us as far as insulin is concerned? People with diabetes who are on insulin.
So just in terms of insulin use, there's a number of different regimens we use for insulin. People can be using a once daily injection. They can be using a twice daily pre-mixed insulin, or they can be using multiple injections throughout the day, what we call basal plus or basal bolus regimen. In summary, most insulins at iftar time should usually remain the same if you are well controlled, or even can be decreased if your control is very good. And then at suhoor, we will usually reduce the dose of your insulin to prevent hypoglycemia during the day. But like we said, it's important to get individualized opinion from your practitioner in terms of how you should adjust your insulin, because regimens with insulin can be quite complex.
Earlier we mentioned this website, DAR Alliance, DAR Alliance, ALLIANCE, Alliance. And in that, besides all the information that there's on that website about people with diabetes and how best they can manage their diabetes during Ramadan, there is also a risk calculator. SAAJIDAH, can you tell us about this?
Okay, so the DAR Alliance website is a really nice website in terms of diabetes education and diet plans that can be downloaded for a week for patients to get information from. And it also has a risk calculator, and the risk calculator takes into account things like your duration of diabetes, your kidney function, whether or not you've got other comorbidities like high blood pressure, whether you've got complications from your diabetes, what your medication regimen is, how often you have complications like a low sugar or a high sugar, whether you've been admitted recently as well, and puts all that into a calculator that tells us what your risk for diabetes is. It stratifies you into either a low risk, medium risk, or high risk, so that we can advise you on whether or not it would be safe to fast, and how safe it would be in terms of experiencing hypoglycemia or hypoglycemic emergency or any complications from your diabetes.
SAAJIDAH, can this risk calculator be done by anybody, or does it need to be done with the help of your doctor?
So it should be done with the help of your doctor, so that you can get proper advice once you get a score, in terms of again what you are at risk for, and what changes need to be made in order to improve your risk stratification or your risk category, and also how changes to be made to your medication. Like we said, it's important usually to do this 1 to 2 or 2 to 3 months before Ramadan, but can be done at any time to improve your control and prevent risks to you as an individual.
Jazakallah for that, SAAJIDAH. There's one question that has come up, which says, why do patients with diabetes have foot amputations? Why do they have foot amputations? That's a question that we need to answer.
Okay, so yeah, that can be quite complex. Diabetes affects a lot of things in the feet. It affects your blood vessels and your blood flow to your feet. It affects the nerves and muscles in your feet as well. And then if your sugar is uncontrolled, it can predispose you to things like ulcers and infections of the skin and the muscles in the feet as well. Things like infections such as gangrene, which necessitate amputations. So altogether, especially patients who have poor blood flow, nerve damage where they don't feel if they are getting hurt, and then develop things like ulcers, which then heal very slowly or become infected. All these factors may necessitate amputation.
Well, that's the end of the show. Jazakallah khair, SAAJIDAH, for being with us. Very informative, and you've been so clear about this. No ambiguity in it. So I hope listeners have benefit from it, and certainly you've been very clear about your answers. Jazakallah khair for joining us and rearranging your schedule. Really, Allah Ta'ala reward you, and Allah Ta'ala be with you. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum assalam. Jazakallah for having me.
Okay, that's this medical file program for today. Until next week, 9 to 10. I'll leave you in the care of Allah subhanahu wa ta'ala. Fi amanillah. Assalamu alaikum wa rahmatullahi wa barakatuh.
Doctors and guests on a medical files program will help you with any medical problems you have by giving you advice